Hi, health champions. In the midst of celebration, let's continue to promote our health. Okay, so I want to quickly talk about gonorrhea as requested from one of my subscribers. Okay, so gonorrhea is one of the commonest sexually transmitted infection. It's caused by organism called Neisseria gonorrhea or Neisseria gonococcus. This particular bacteria is present in infected persons discharged from the fecus or discharged from the bora. It can affect both men and women. It can even affect unborn child if you are pregnant. Men mostly exhibit or show signs of gonorrhea more than women. All right, but you can carry gonorrhea whether you show the signs or not. You can still infect people even if you don't show the signs. Let's talk about means of spreading this organism. Gonorrhea can infect your cervix, which is the neck of the womb. It can infect the urethra, which is the pipe that brings urine to the outside. It can affect your rectum if you engage in anal knacking. It can affect your oral cavity, right? It can even affect children, it can affect your eyes. This organism can spread between two people during unprotected fecus knacking, unprotected anal knacking, unprotected oral knacking. When you use infected knacking toys, you can get this organism. So what are the symptoms of gonorrhea? Okay, it can affect both man and woman, and you might experience symptoms after 2 weeks of being infected. Sometimes it can last up to some months. So let's talk about typical symptoms of gonorrhea. One is unusual discharge from your fecus or from your bora, which might be yellow in color, it might be green in color, but it might be copious, it might be too much. Number two is that you may feel pain whenever you wee, burning sensation whenever you pass urine. You might even feel pain during knacking. You might even bleed during knacking if you're a lady, okay? You might even feel a lot of discomfort, pelvic pain. You might have tenderness or pain around your testicles if you're a man. Sometimes you might have swelling around your foreskin, the tip of your bora, you see some swelling around there. As for a child, there will be noticeable swelling on the child's eyes, there will be discharge from the child's eyes, there will be sensation, irritation on the child's eye. Gonorrhea can cause conjunctivitis and in severe cases can cause blindness to a child. All right, let's talk about proper hand hygiene. This is the easiest way to protect yourself from infection, especially oral infection, fecal oral, from your poo to your mouth, fecal oral infection. Okay, we are advised to wash our hand using 6 methods according to WHO. The first method is to wet your hand with water. Pour. Second method is to pour enough soap on your palm of your hand, then palm to palm for 15 seconds, back of palm for another 15 seconds. Okay, fingers interlace for 15 seconds, fingers interrupt for 15 seconds. Your thumb, wash your thumb very well for another 15 seconds. Wash your thumb very well. Okay, now fingertips to palm for 15 seconds. Your wrist, wash your wrist and rinse your hand, pat dry. With this, you can cover all the hand surface. Try it. Gonorrhea has so many complications. Gonorrhea can cause conjunctivitis if infected semen or fecus fluid come in contact with your eyes. You will feel irritation, you will feel discharges from your eyes, you will feel a lot of discomfort. Okay, gonorrhea can as well cause blindness in children. If you are a pregnant mother and you have gonorrhea and you don't treat yourself, it can cause blindness to your child. Gonorrhea can as well cause conjunctivitis to a child. Gonorrhea can cause premature delivery. Gonorrhea can cause miscarriages. Gonorrhea can cause you to have heavy bleeding. Gonorrhea can cause fertility problem because it affects the testicles of men. Let's treat ourselves. If you have gonorrhea, if you experience symptoms of gonorrhea, if you recently have unprotected knacking with someone, you are at risk of having gonorrhea. Get yourself treated and protect others. Whenever you treat yourself, treat your partner. Treat your partner. Call that person. Tell him or her, you have gonorrhea. I think you should be treated. It's very important. Thank you and stay safe. So let's talk about the treatment options for gonorrhea. Gonorrhea responds very well to antibiotics because it's caused by bacteria. So whenever you see symptoms, you experience symptoms, or you suspect that you have gonorrhea, go to hospital, get yourself tested, and receive your injection, antibiotics injection. Okay? If you prefer oral tablet, there are some options available for you. All right, get yourself treated and then get relief from the symptoms. Then it's very, very important to get your partner treated as well. If you notice that you have gonorrhea, inform your partner. He or she needs to be tested and treated as well. Otherwise, you can get reinfected with gonorrhea. Okay, then there are certain food that science has proven because of their high antibacterial properties, they have proven that they can help you to get rid of gonorrhea from your bloodstream. One is garlic. Garlic has a very strong antibacterial properties. Another one is ginger. Is very strong for protecting you from gonorrhea. Then lime. Lime is very okay because of its high antibacterial properties. You can as well drink apple cider vinegar. They are all good to protect you from gonorrhea. Lime, ginger, garlic, and honey. Lime, ginger, garlic, and honey can do the magic. Thank you so much for listening. Try and share this video.